I'll be talking about cultivating mentoring relationships. And you know who I am, but I'm currently at the University of Pennsylvania. I'm a tumor and adult recon surgeon, and I have a particular interest in education. Uh, my official role is in undergraduate medical education, but really that interest extends across the spectrum, even before and after, and continuing education, and so on. And mentorship is a really critical part of development for all of us. And so we will be talking about the scope of planning, building, maintaining, and troubleshooting mentoring relationships. And this is largely going to be focused on the mentee perspective, but I would say that most of these, if not all of these principles, really apply in both directions. So you will learn something, hopefully, about being a mentee as well as being a mentor. And I can promise that each of you, regardless of your level, um, are both of those roles now. And so both are important to think about. So even, interns that are out there, you're still looked up to by a lot of people, medical students and so on. And even the most senior people here can still benefit from mentors. So that said, I did want to get some initial thoughts from you guys on what you see as the benefits of mentorship. So anyone can either shout out, or maybe someone who can see people can let me know if anyone has a comment. You can put something in the chat. But why do we need mentorship? Or why do we want mentorship?
I think that, hindsight is 20/20. And if you can benefit from somebody who's already walked that path, even though it might not be your path, you can get some really valuable advice.
Absolutely. So Sarah, yeah, prevent you from making the same mistakes that someone else did, or maybe make your path more direct, or help you figure out the right direction. Okay, great. And anything else?
I think I've really seen it in like connecting with resources and like kind of streamlining, like, this is kind of where I want to go, and having someone be able to say, okay, these are the resources that you can use, just because they have much more knowledge about kind of resources and things to help you on your path.
Okay, so tapping into experience. Excellent.
And then just encouragement can be helpful too. Just like encouragement and support, like when you are having, trouble or don't know what you want or what you want to do.
Absolutely. Absolutely. Encouragement. Love that. Yeah, we all need that. All right. And so if you could all just take a minute and think about a mentoring relationship that you've been in. It could be either as the mentee or the mentor. And but probably, again, focusing more on the mentee for now. What was so great about it? This relationship that stands out to you? How did it help you, and why was it so effective? All right, so everyone think, picture that mentor or perhaps mentee. All right, and any comments on that? Anyone that can share?
I found it to be helpful when a mentor creates space for you in places that you are not. And so like advocating for you when you're not around, or letting people know you exist.
Absolutely. Yes. Great point. Okay.
I think I found it most helpful when your mentors are giving you advice based off of your individual personality or perception of what's going on, despite like kind of their experiences or whatever path they took, like not just giving you their generic preferences, but kind of tailoring their advice to you as a person.
Yes, absolutely. Because the right path is going to be different for everyone. Awesome. All right. You guys summed up a lot right there that we're going to be talking about. And so I'm going to start by going through what I think of as the elements of mentoring. And the first is advising, and these are the different roles that mentors can play for us. And I think advising is what we do most frequently, and it comes to us most naturally. I mean, as doctors, mostly what we do is advise patients, and every time someone calls you with a consult, you're giving them advice, and those are suggestions based on your own experience and knowledge. I mentioned there's, if someone directs you towards resources, or there are some other comments along those lines. So someone else's experience and knowledge, when they share that with you, that can help direct your course, and that's advising. It And then second is sponsoring, and that was mentioned as well. So when someone is sponsoring, they're promoting, connecting, and creating opportunities. That's when someone is in the room and hears about an opportunity and throws your name in the hat, or calls up the program that you want to uh, go to, where you want to do your next step of your training, and vouches for you, or nominates you to be on a committee. That's sponsorship is also unique in that they're really putting themselves out there for you as well, because if they're giving a recommendation, then your follow through really reflects on them as well. So that's something, a concept we'll come back to. And then lastly is coaching. And when someone's coaching, they're going to help you to reflect, help you to synthesize your own thoughts, and challenge you to think further. And this is a little bit what you were referring to when you said that, everything has to be based on you and your specific course. And that's such a great quality of a mentor, when they're not just spitting out advice that was applicable to them, but really understanding you. And sometimes you need help understanding yourself, and you need to clarify your own path. And a really good coach or a mentor, and when they're acting as a coach, can help you figure that out. So while advising is the thing that we do most often, it's, as I mentioned, we're most familiar with it, and it's also the quickest. Like I can give someone advice in 1 to 10 minutes if it's really complicated. But even the most basic coaching conversation is hard to do in less than 10 minutes. So there's different ones, different roles are applicable in different scenarios. One of the things I'd like you guys to think about as mentees is developing a mentorship network. And what I mean by this is that you start by thinking about in what areas would you benefit from mentorship? And this can be anything really. So this can be your career path is pretty broad. It might be certain elements of your clinical practice, how to run an efficient clinic, or what to do about a certain case, for example. Classically, there's research and education if you're in an academic career, but it could be something else. It could be about family planning. It might be totally unrelated. Maybe you want to learn and become better at rock climbing. I mean, it can be whatever you want. So I'd like to give you a minute and just think about the areas that would benefit you, and think about what these spheres would be for you. And we can listen to can you hear my screaming child in the background? All right, so just think about this for a couple minutes. I'll give you a minute here. And then once you have your ideas about what are areas that you might benefit from a mentor, think about who is available that or perhaps maybe don't know yet, who would be able to advise, sponsor, and coach you in each of these areas. And this is an exercise that we might take a few minutes, so we don't need to do all of that now, but do start the process. And I think what you'll find is if you map this out like a grid, there will be certain areas where you have a lot of mentorship, and then you break down what that mentorship looks like. And so if clinical practice is one of these for you, you might have great people who can advise you in clinical practice. But if you think about, another element, you might not have that. So let's take a better example. Maybe in your career path, maybe you have someone that can give you advice, but maybe you need someone who's going to sponsor you. And so think about who would be in a position to sponsor you and talk to them about it, or try to establish that relationship, which will be the next thing we go over. You might also benefit from coaching if you're not entirely sure what your direction is, and think about who might be able to coach you. And they might not be the same person that's going to sponsor you. But just if you think about these different areas and different roles of mentorship, you might find certain aspects of your network that you'd benefit from filling someone into those gaps. So then moving on to building the mentoring relationship. And there are a couple different ways that this can come about. So we often think of mentoring relationships as being organic, and you run across someone, you feel like you have a great connection, you have similar interests, and it sort of builds from there. There are also organized mentoring relationships, and those are pretty common. Those can be either through the residency program. I know there's one at WashU. We have one at Penn. But it also can be through national organizations. So, for example, the Women in Arthroplasty group has a mentoring program. I think RJOS, has a mentoring program. And neither of these is perfect. But they both can be quite effective. And I think the thing to remember, that I would encourage you to remember here, is regardless of which path your mentoring relationship is on, the seed or the beginnings of it is typically an ask for help. And I think this is something that is inherent to most of the organic relationships, because that's how they start. You ask someone to help you get you a research project, or you approach them with some other request, and that's the basis of the relationship. I think one of the reasons that organized mentoring relationships don't always work, or sort of don't take off, is because we forget to ask for help. And if you just show up to your organized mentor and check the boxes of your OITE score and your duty hours, and don't think about how to something to ask them where they can help you, then you're not going to have that nidus for the relationship developing. So I would encourage you to think about that. If you're showing up for an organized meeting, maybe just also show up with a question about something. Could be anything, and that'll give your mentor somewhere to start. And then also to discuss any expectations. So unless you truly have no expectations of the relationship, which is very possible, and maybe more so on the organic side, but if you do have any expectations, and this goes for mentors too, be sure to lay them out. So if I say as a mentor, please, I want you to be the one to contact me, or you can set up a frequency of your meetings, or you want to do it by phone, or you want to do it in person. And I think we've all probably started off the road in some relationships, and they feel like they're not working out, and it's about an expectation thing. I've certainly had organized mentees where, I think it would be really nice to see them in person, and it keeps not happening. And then I get sort of, disappointed, or feeling like this is not going well, but really it's different expectations. It's easier for them to talk by phone. And the minute we set the expectation of, okay, we're just going to do phone calls, everything feels much smoother. So I think there are some logistical things that if you have that conversation up front, frequency of meeting, style of meeting, what someone brings to prepare, how follow-up happens, that can be really beneficial to starting off your relationship as well. Then we get to making the most of your mentoring relationship. And I think as I was preparing this, I could think of 3 things that were really important for this. One is a little bit of introspection before talking with your mentor will really help that conversation be more meaningful. The same thing with preparing for a meeting, and we'll talk about what that means. And then lastly, bringing some vulnerability to that relationship. So for this, I think it's really helpful to think about what are your goals. If you have a sense of what those goals are, that'll be a really good starting point. So for example, if you know where you're trying to get, you can ask your mentor for better advice. You can better ask them for sponsorship. How are they going to sponsor you if you haven't articulated your goals to them? Or if you're not clear about what your goals are, you can ask them to help you figure it out. You can actually ask them for coaching. Help me think through this, which is different than give me advice. Also, areas of where do you need to develop, and how are you struggling? I mean, these are really critical things that are much more meaningful than what your in training scores are. I guess that's meaningful in a different way, but I would argue that in your mentoring relationship, these are the things that are most meaningful. And so, doing that work of introspection up front will help you advance as far as you can independently, and then your mentor can help bring you to the next step. Likewise, preparation for your meetings. If you know you're going to be meeting your mentor and you come with 1 or 2 questions, I find it tremendously helpful, and we're really it feels from the mentor side that you're able to provide much more benefit if there's a specific ask or a specific topic. It doesn't have to be all that way all the time, but it really helps you focus in the time that you have. And then lastly, the piece about vulnerability is just so critical. This needs to be a relationship with trust on both sides. And I think it actually helps for both the mentor and the mentee to show some vulnerability. And maybe the mentor has to do that first. Hopefully this is, it feels like a safe space for you, but it's going to be really hard to get anywhere in terms of development if you're unable to show how you're struggling, what your weaknesses might be, because those are the things you want to address with your mentor. In terms of maintaining the mentoring relationship, I think there are 2 things. One is follow through. So accountability, so following through on the things you've talked about, is actually a way of demonstrating your appreciation. And the corollary of that is that if you don't follow through, it feels like you don't really appreciate the work that your mentor is putting into the relationship. So follow through on whether it's agreements to set up your next meeting or anything else. I think that's really key, and that's for the mentor side as well. And then following up. For mentors, the reason we do this is because it's really meaningful to see an impact to have an impact, and we all want our mentees to do well, and it's so rewarding to feel like you're a part of that. So getting to see the impact is in itself the reward. So if your mentor has written you a letter of recommendation or sponsored you for a position, and you get that position, you absolutely want to let them know. And even if you don't, just letting them know what happened is a way of showing that you appreciate it as well. And then, if you for whatever reason, don't get this example position, then you can think about what the next steps are going to be together. So, barriers to mentorship, and these are things that we might want to talk about as well. But time. So, we never have enough time. So, it always feels like there's a good reason to cancel a meeting. And I can tell you, I have some relationships with mentors where, every few times I'm supposed to meet, it just feels like I have so much to do. Today's really not a good day. I haven't had as much time as I wanted to prepare, but I go through with it, and in the end, it's always a good meeting. So even though there's always a good reason to cancel, I would encourage you not to. And time is always going to be a barrier, but this is one of those not urgent but extremely important things that you should prioritize. The other is value. If you're not seeing a benefit in the first couple sessions, my recommendation would be to give it a little more time, and or make a little more preparation, maybe a little more vulnerability. Think about those things that make the relationship beneficial and make it work, and try to figure out how you can add those elements to this particular relationship. Specific knowledge. So if you're looking for advice in particular and your mentor just doesn't know enough about the topic to help out, that may be a real limitation. And that's where you go back to your mentoring network and think about who else is in that network that might be in a position to better advise you. And if there's no one, then who would that ideal person be? How can you meet them? Maybe your current mentor can actually sponsor you through an introduction. Also, concerns about hierarchy or stigma. If this gets in the way of the vulnerability piece, and you don't feel comfortable sharing the real thing, that could be an obstacle. And for that, I would think about, is that real? In which case, you might need a different mentor for that particular topic. Or is that, if that concern is more one that's in your mind more than in theirs. If it's not a good fit and you don't feel a connection, you give it some time. You've done all these things. That's very possible. You're not obligated. You're not married to this particular person, and you can either drift, or if you need to, have a conversation and move in a different direction. So there could also be limitations in style. Maybe your mentor only gives advice and you notice that you really need more coaching or sponsoring about something. And that's something you can bring to their attention. You could sometimes you might have to say, I'd really like X or Y position, and ask for sponsorship. Some people are very happy to sponsor, but are just it's not what comes naturally to them to be on the lookout for opportunities to do that. And so they might actually need your help to point out when you need a little bit more sponsoring and when you need a little more coaching. It's also possible that they just are limited in those capacities, in which case, again, maybe you want to seek someone else out for those particular aspects of mentorship. And then in terms of accountability, if either the mentor or the mentee is not making time preparing or following up, which are the key elements that we talked about, then that can be a little bit of a disappointing or frustrating relationship, and you can either work it out or decide that it's not going to work. But being aware that that's where the frustration may be coming from will help you figure out if that's something that can be remedied or not. And it'll also help you avoid making those same oversights as well. So those are all topics that we can discuss more. I'd love to hear from you guys. And that's all I have in terms of presentation. Thank you.
I have a question for you. I think particularly as more of like a mentoring role, I think I struggle with balancing like the guiding and empowering aspect for like medical students interested in careers in orthopedics, with then also trying to be realistic and not create like false expectations or kind of like a false sense of reality as I advise them. What advice do you have to kind of balance those roles as a mentor?
I think that's a great question and very challenging for many of us because we want to be encouraging. And I think being realistic and being honest actually I should have had a little note about that in the presentation as well, because that's at least as important as the rest of these things, right up there with vulnerability and so on. But honesty is absolutely key. And as someone who does advise a lot of medical students, and to be clear, my role there is actually an advisor. So, we coach them and I talk to them about those things too. But at the end of the day, I also need to give them advice. So, if you take the example of if I have a medical student whose scores or transcripts, whatever it is not is concerning that they might not match in orthopedics. Do I discourage them, or should I be encouraging, or should I be honest? And I think it's less of a dichotomy than that. I think starting with the facts is always really important. So this is what I see in your transcript, or for example, it is going to be hard to match in orthopedics with only one course that you honored. And that's a fact. Like, I'm not telling them they're going to match or they're not going to match. I'm not telling them even what they should do, but I'm just laying that out there for consideration. And or say someone has not performed well clinically on their sub-Is, and then I might, in that example, it would be the feedback was, there was mixed feedback, or there were concerns noted. Here's what you would have to do to address these concerns. And so, or here's what I would recommend. I would recommend studying, taking a chunk of time and building up your fund of knowledge. I would recommend this, or, whatever it would be. I might also couple that with a coaching type approach to, is this really what you want to be doing? And if so, you can take two routes. And one route would be, yes, I'm all in. Let's move forward with this. I'm going to take the time. I'm going to dig in and learn these things. Or you give them the opportunity to pursue something else. And again, I wouldn't necessarily encourage them one way or the other. Just lay out what the two different directions, or three or four, whatever it is, might look like, and help them to understand the risks in either direction. So it actually becomes a little bit like a conversation with a patient in the way. Like, you can go for the girdle stone. There's going to be no risk. I can promise you that, no risk of infection. We'll have you done in an hour, and this is going to be your functional outcome. Or we can go with the big pelvic reconstruction, and these are the risks, and these are the potential rewards. So I think laying it out there with as much honesty and as much information about what each path might look like is a way of doing that while you're still empowering them to make the decision, but you're not, understanding that you can't make a guarantee. You can't promise them they're going to match in orthopedics. Does that make sense? Is there anything else? Yeah.
Sure. I think the approaching it with facts, I think, makes a lot of sense, because I think that's where I get stuck. It's like, I don't want to, dash their dreams, but also not set them up for failure. So I think just starting with facts is a really good point.
Right. Yeah, I think any feedback starting with facts is really, it's a really good place to start. Start with something as objective as you can. So I noticed that, I see your transcript in front of me. This is what it looks like. This is what your scores look like. This is how that is lower. than the average student that matches in orthopedics. Or I noticed, or I've gotten feedback that you fall asleep in lectures all the time. This could be problematic. Yeah, lots of things like that. So it's not just that, I don't think you're good or I don't like you. And I think that's, I would always start with that. You're still on their side. I would say even I remember this is actually I don't typically, like all of us, I don't discourage people to go into orthopedics, but there was, when I was a resident, there was a medical student who was interested in orthopedics, and she had a really devastating elbow fracture as like a child. And, I don't remember the details, but basically she was 20 something with pretty severe elbow arthritis. And I remember, like, okay, so what are the things you can do? She's like, well, it hurts me to brush my hair. So and as much as I said, I don't want to, I would never discourage you from something you want to do. That said, I would think carefully about whether you want to use, what remaining function you have of your elbow, if you want to dedicate that to an orthopedics residency and the uncertainty, that might come with how things go after that, against what are the other things that are going to be important to you. Are there any activities? Do you plan on, if you plan on having a family, like lifting up your kids and things like that. So, and just sort of lay it out that way, and then they can make their own decision. But I think being realistic about the challenges is key. All right. Yeah.
You're still sharing your screen. If you could unshare them, I think we
I'm sorry.
There we go. Thank you. Any other questions?
Anyone else have any other questions or thoughts?
I have a question for people who are interested, and you talked a little bit about the responsibilities that each person brings to the table, but if somebody is interested in getting a mentor, like I want to have Cara Cipriano as my mentor, what do I do? How do I approach that person, and what do I bring to talk about this, or how do you get that conversation started?
Well, I guess it depends on your situation, like how remote that person is. I think any of you could go up to anyone in your program or that you work with a question or some form of ask for help, and I think it would be very well received. And people like to be asked for help, especially when they can solve when they can help, when it's something where they can actually help. And so I think that's well within reach. If you know someone, or if you're targeting someone that is that you don't know personally, then if you can manage an introduction, like if there's someone else that that could connect you as an active sponsorship, that I think the two of you would have a lot in common, and put you in touch. I think that's great. Or, I mean, you can always cold contact someone, and most people will probably respond positively, especially if they're the sort that's going to end up being a good mentor to you. But if you do that, I would have a specific reason for doing it. If there's something, we're all at the level which we're not just going to, email, everyone in the department, oh, I read your research and it's really interesting. Like, it's not, that's, I think a stage, ahead of that. And so if there is something specific that interests you about that person, that is enough that you're seeking them out specifically, I think that will come across in whatever you write to them. that's not so much the case if you're writing an email to, 15 people. You don't have that connection or that interest with 15 people. Like, you just don't. But if there's something specific enough that you want to reach out to a single person, I think that will come across. Do you still have the organized mentoring program at WashU? Is that right? Do you feel that people get meaningful mentoring relationships out of that, or is it just sort of a check the box kind of thing?
I think it's hit or miss. I think some people, just like it always has been, you get paid so you have somebody, but people find their own way, and some people stick with their mentors and other people, have more specific mentors to what they need as they go along, but the other person is there as a backup or if they have other questions. So I definitely think it's in some ways a check the box, but some of them become more of a relationship than others. What do you?
That's spot on. I think that, at least personally, the accountability, on my part, like I didn't reach out to the mentor enough. And I think that that's pretty common with the mentors who, really reached out to the interns, especially with the power dynamic. Those that really reached out and took them to dinner, I know that those classmates of mine have longer lasting relationships. So I think that, accountability now in retrospect, is a really
Do you have any?
I think, yeah, sorry, go on.
Oh, I was just wondering if you have any advice for if you are assigned a mentor that perhaps isn't a good fit, just based on the vision that they have for the relationship or their priorities. If you would love to have somebody else, like how you navigate that, or if it's just better to have more informal mentors in that case.
Yeah, I think if it becomes apparent early on, then they can still be your check the box, mentor. But yeah, seek out other relationships, and I think really it may not seem like it from your perspective, but people at academic institutions are there because we like teaching and mentoring. And I think anyone would be thrilled for you to knock on their door and say, you know, would you be able to help me with a question? And you don't have to come out and, if it feels awkward, you don't just have to say, will you be my mentor? But I was hoping I could ask your thoughts on something. And then maybe, a month or two later, you maybe ask their thoughts on something else, and you can build something organically that way. But I think that it does, then it'll require initiative. Or you can, especially if you're graduating or something like that, and you say to someone as you're leaving, hey, would it be okay if I called you up every once in a while to ask you about these things? I mean, I would be delighted if someone said that to me. So I just think don't underestimate that would be well received by pretty much everyone, and even people outside of academics. I mean, people love to be. It's an honor, and it's flattering for someone to come want to learn from you and know more about your way of thinking. And I think the right person, if they're interested in that for the right reasons, will be a great resource and will be happy to do it. One of the things also about, yeah.
Well, I was just going to add the corollary to that is the person who's assigned is not going to be offended. They have plenty of other things to do, I'm sure. So, I think like Sally and I were assigned to each other, and we met pretty often early on. And I don't know if Sally wants to speak up, but she is going into shoulder and has great mentors in shoulder and has slowly drifted over to them. So I'll email every once in a while and just check in, hey, can I help you with anything? But we don't regularly meet like we used to, because I know she has other mentors, but hopefully she knows I'm still there if she did need them. But it kind of drifts in different ways. So I think it's organic to some extent.
Yeah, and I think that's actually very classic that the organized mentor, if you have one in your program, is most important in those first couple years. And then as you develop the organic relationships, those will sort of take over because you'll have more in common in terms of your goals. They're better able to advise and sponsor you. And so that will kind of ramp up. But just remember that, sometimes it's actually nice to have a relationship with someone who's not in your directly in your scope of practice, and or even someone who's outside your department. That can be really valuable too. So either for confidentiality reasons or just a different perspective, that can be really helpful. So that's why it's nice to have a mentoring network and not just a mentor.
Kate Buser had a question, so we're getting her on camera here.
Hi, Dr.
Hi, Kate.
Still here.
It's so great to see you.
Well, I was going to make another comment for Carson, is that your needs may change, or your mentoring needs may change. And I think it's really nice to Dr. Miller's point, to have someone maybe who you may not think is perfectly aligned. Because I had been assigned a mentor and they left for another institution, and I was assigned another person. I was like, oh no, like, I really wanted my other mentor, but I found that in talking to him over time, he gave a really good perspective that some of the other attendings didn't have, just based on, as your career goals start to formulate. And, so don't underestimate, if you don't think it's a perfect match right now, they may still have some really good quality advice to kind of help as you mature through residency.
I just wanted to give also, while we're at it, a shout out to our couple Penn residents that are here. I know you guys are maybe in the middle of something else, but if you had anything, we're glad you're here. Welcome. If you have anything to add, please feel free to chime in. Yes. What's that?
I got confused because there's two Caroline Grand something on. Green
Yeah.
Jordan, Green
Oh, if there were two Carolines, that would be fantastic. But unfortunately, there's only one in real life.
I think there must be a different one, because I'm me and I'm not the other one.
We have very
So I have another question, unless somebody else has a question. So one of the things we've talked about a lot is this idea of the minority tax, where a minority, whoever it is, a faculty or a resident or a medical student even, is asked to do a bunch of extra things to represent the minority group to other groups, or to be a mentor for those groups. So how do we support people being mentors that are not necessarily in that same minority group to help with that, or support the people who are doing those mentoring from a minority group to make sure they're not overwhelmed by that?
That's a really good question. And actually, I should say that I know both Carolines, and they're both terrific. So, I think the issue you're talking about is extremely real. I was actually just talking with someone about it this past weekend, one of our minority faculty, and I think that in certain circumstances or on certain issues, it can be really important and beneficial to have concordance between the mentor and the mentee. And Kate, this is something that Kate has actually studied, so I'll ask you to comment as well. But so in some ways that can be really helpful, but it's not everything. So for example, sometimes someone who's concordant might not be the best person to sponsor you. I think, if we all take ourselves as examples as women in orthopedics, there are relatively few of us in leadership positions compared to men. And so odds are that the best person to sponsor you who's in a position to actually give you a hand up in some of these situations is going to be male. And so in that case, concordance doesn't matter. However, if you want to do a little bit more coaching or advising related to being a woman and having a family, obviously your male mentor is probably not going to have as much insight. And so in that situation, concordance is important. So I think it's about having, again, multiple mentors and having it be a network so that when it is a relevant issue, you have someone that has that concordance when it's helpful, but not to rely on them for everything. The other thing is that I think actually talking to the people who are minority mentors and getting a sense of their level of interest and their capacity is also really key, because they may live for this and that's all they want to do, and that's fine, but they may likely have other obligations, and just getting a sense of where they are on that spectrum with their other career aspirations, with their non-professional commitment, their outside of work commitments, and so on, and how much capacity they have before kind of assigning them a bunch of mentees or sending every minority student in their direction. So I think those are important. And then it gets a little bit more, I'm also sensitive to, and I think this is a complicated issue, the balance of how much, like, for example, how many, if the department should also be giving resources that can help them as well. So for example, if someone who's a minority faculty wants to take all the minority residents or students out to dinner, should the department pay for that? Or should there be some source of funding for that? Because if not, then they're basically taking the double hit of their time and their resources. So I think that's a bit of a complicated issue, but one that I think about as well. And so there might be other ways of offering support that are sort of situation dependent.
Well, we're coming up on time, so I just want to make sure we're kind of wrapping up. If there's any last minute thoughts or questions. All right. Well, we appreciate everyone coming tonight. Thank you, Dr. Cipriano. It was wonderful to hear from you, and we tremendously appreciate your expertise and your guidance in this area.